Endodontics is the treatment of disease or trauma inside a tooth. A tooth has got a hard shell on the outside, but in the centre it's got a blood supply and a nerve supply, which we call the pulp chamber. If through dental decay, through trauma, for a number of reasons, the blood supply is lost, then the nerve supply is lost. And at that point we have an empty tube and an empty chamber, or an infected tube and an infected chamber, which harbour bacteria. These bacteria produce toxins, they can escape through the end of the tooth, and what we have to do is clean out that chamber, clean out those roots, so that we can then completely obliterate the space. And having obliterated the space, then we have a successfully restored tooth. One thing that's very important is the fact that we now have to adhere to the new guidelines called HTMO 105 and CQC regulations, which we have been doing for many years, but now it's regulated. But the patients can be assured that all the instrumentation that we use is sterile. We follow the guidelines very strictly. We want to make the patient journey as pleasant, comfortable and relaxed as possible. When we contact them, we send a welcome pack, and that welcome pack will have the appointment in. It'll also have a description of the treatment that they're going to be receiving. We've made every provision in the practice for the convenience of the patient. So we have on-site parking, and when the patient arrives, they'll have a warm, friendly, relaxed introduction by all our qualified staff. We can sit them down. We have a relaxing waiting lounge with coffee, music and a television. And when they come into the surgery, we will again explain exactly what is going on, so they know exactly what treatment they're going to have. They're going to know what the cost of the treatment is before they come in, and they can be assured then that they will understand exactly what it is we're going to do before we do any treatment.
I really like Alan because he's really friendly, he's got a sense of humour which you don't really often get with a lot of dentists. Some people are quite like upper stiff lip or whatever, but he seemed really friendly, and when I first went in there he made a joke that put me at ease and just calmed me down a bit because I can get quite nervous of treatment.
Alan is a very lovely man. He's very kind and very gentle, and he goes out of his way to make sure that all the treatment that you need is done, and he's extremely thorough. But most of all, he's very kind and very gentle and very genuine man.
Dr. Holland inspires great confidence, and I'm a very nervous and anxious dental patient, and within a very short time, really, during my first visit, he completely relaxed me, and I think this is a major point for most patients. The feeling that the dentist knows exactly what he's doing and that it's painless.
Dr. Holland basically looks after you with all his treatment. He doesn't let you go home thinking, what has he just done? It feels weird in my mouth. He's always telling you what he's going to do, and then he's going to like do it on your tooth and keep saying what he's going to do before you even go, oh, what's he going to do?
In 2003, we opened Bristol Endodontic Clinic, and since that time I've been providing a referral service to people from Penzance to North Wales across to the home counties. It's a fantastic job to be in, and it's something which very few people want to do, like doing. I just happen to be one of those that does.